Magandang araw! Today, allow me to share sa inyo itong product ni AIA Philippines called HealthLink. Itong product na ito actually is matagal na with AIA, but we just recently revamped this product so mas naging comprehensive yung benefits nito. And is still the most affordable and comprehensive health card or HMO in the Philippines. As what I've mentioned, this is a product of AIA Philippines. Kung familiar kayo kay Film Life, it's the same company. AIA at a glance, we are the largest listed company on the Hong Kong Stock Exchange, and we are the largest life insurer in the world. So yung product that I'll be sharing with you today, once again, it's called HealthLink. It's a comprehensive insurance plan, an all-in-one protection. It has the HMO benefits, plus the group life insurance, the accidental death, dismemberment and disablement, and also it has total permanent disability benefit. Okay. This plan, it pays benefits on top of PhilHealth. And there are two ways to avail the services. First is through in-network. And the network that we use here is the medilink. And the other one is for reimbursement. And the requirements, if you have a business, which is a sole proprietorship, we just require the DTI permit. And if it is a corporation, then we will be needing the SEC registration and, of course, the AMLA documents. So these are just the sample of the card that being issued by AIA and medilink. Membership eligibility, employee groups with at least 5 regular employees. Member must be ages 18 to 64. No pre-acceptance medical checkup. It can be extended to dependents subject to hierarchy. The ineligible group are the groups which involve special hazards and risks. So what are the key features of this plan called HealthLink? So first, it has the basic medical or the inpatient benefits. So this is a mandatory benefit. And then we have the outpatient benefits, which is an optional benefit. Prescribed medicines, this is one of the new features of this plan. It's also optional. We have the dental benefits, which is also an optional benefit. Annual physical exam, also an optional benefit. And this benefit requires 50 employees to be enrolled. And then we have this new benefit also with this HealthLink revamp, which is a maternity benefit. This benefit requires 50 female employees. So let's just discuss one by one the benefits that we just showed you. First, it has this mandatory plan, which is the basic medical or inpatient benefits. So this one, it covers insured members' expenses during confinement per any one disability and pays benefits for the following services. So it pays for the room and board, other hospital services, surgical fee, doctor's calls, emergency calls. And all of these basic medical benefits are subject to a maximum amount per service, also known as inner limits. And benefits are also subject to an annual benefit limit. Later, I'll be showing you an example how this inner limits and annual benefit limit works. Also, for the mandatory plan, we have this yearly renewable term life insurance. So it provides life insurance protection anytime, anywhere, and against any cause of death, except suicide on the first year of coverage. Total and permanent disability. So it pays lump sum of benefit to an insured employee rendered totally and permanently disabled due to any occupation, and also accidental death, dismemberment, and disability. So it provides an additional benefit if an insured dies, gets dismembered, or is disabled within 180 days from the date of accident. And then, of course, we have this optional benefits. So we have this outpatient benefits. It covers consultations, treatments, laboratories, diagnostic examination, and other procedures provided to an insured member without need for in-hospital confinement. So in the outpatient benefit, we have this general physician or specialist consultation. So we cover consultation fees for outpatient or general physicians specialists on one consult per day, maximum of 20 consults per year. Treatment in clinic during consult, so it covers treatment fees. Examples of this is bandaging of minor wounds without the need for in-hospital confinement. Diagnostics, x-rays, and laboratory tests, so it covers lab tests and x-rays as recommended by a physician for the diagnosis of a sickness or injury. And then we have this prescribed medicines. So this one, it reimburses the actual expenses incurred for the purchase of prescribed medicines as recommended by the physician. By the way, this optional benefit, this can only be availed if outpatient benefits is availed. Also, we have this maternity benefit as an optional benefit. So it covers expenses relating to maternity and obstetrical cases separate from the basic benefits. This optional benefit requires minimum of 50 female employees. Okay. And then we also have the annual physical exam. So this benefit requires minimum of 50 employees. And last optional benefit that we have is the dental benefit. So it covers expenses relating to dental cases, and these services or these procedures can only be availed within MaxiCare Dental Hub. It cannot be reimbursed if done elsewhere. So now, let's talk about the schedule of benefits. So as you can see here, we have these 5 plan options, 500, 750, 1,000, 1,250, and 1,500. So these are the plan names that we have. And as you can see, there are amount or figures for each plan option. So this amount or figures are called the inner limits. So what are those inner limits? Ibig pong sabihin nito, ito yung mga amount lang that the plan will pay. Okay? So let's just take, for example, this plan 500. So as you can see here, these are the inner limits for the plan 500. Based on our example below, our member, for example, or our employee has been hospitalized for 5 days and the room na na-avail niya is 700 per day. So yung room bill niya is 3,500. For this particular example, which we are talking, or the plan 500, 500 per day yung shoulder ng plan, no? For 5 days nga siya na-confine, 2,500 yung shoulder ni plan for the room and board. Yung 200 per day na excess will be paid directly ng member sa hospital. Okay, but for example, no, 700 per day nga yung room na nakuha niya for 5 days, pero ang plan pala niya is plan, this for example, plan 750. So that means wala nang babayarang extra si member. Okay, same idea with the other hospital services, surgery, and doctor's call. For this particular example, ang kanyang total bill is 29,000. Ang na-cover ni HealthLink is 25,000. So, yung 25,000 na yon na na-cover nitong plan, no? Based dito sa example natin, ilaless ngayon natin dun sa annual benefit limit ng plan na na-avail natin. So, we're talking about the plan 500. Ang annual benefit limit niya is 150. So, ilaless natin yung 25,000 sa 150, meaning may 125,000 pa no, na magagamit yung ating member until the end of the policy year. Okay? So, that's how the inner limit works for the basic medical. And once again, no, na-share ko kanina, di ba, na yung ating mandatory plan, meron siyang kasamang group insurance. Okay, so for example, sa plan 500, ito yung group term life insurance. Ito yung amount na marireceive ng family if ever yung member ay mag-pass away. Sa TPD naman, kung ang member naman ay na-TPD, kailangan ay 6 consecutive months siyang TPD. On the 7th month, ibibigay na sa kanya itong amount na ito. kumbaga ina-advance na kay member, no, yung kanyang life insurance kasi pag TPD siya, hindi na siya makakapag-work. And then for the ADD&D, if si member, for example, ay nag-pass away due to accident, ito yung marireceive nung family, the 50,000 from the ADD&D and another 50,000 from the group life insurance. And then kung nagkaroon naman, for example, ng dismemberment, meaning nawalan ng parte ng katawan, so depende sa part ng katawan na nawala, yun yung marireceive nung member. Okay? So ito yung schedule of benefits once again for the inpatient. And then of course, we have the schedule of benefits for our optional benefits. So for the outpatient benefits, we have this consultation of maximum 20 per year, treatment in clinic during consult, maximum of 20 per year then, and then we have diagnostics, x-rays, and labs, which has maximum amount per year for each plan option. Okay, just for example, if our member, no, ay nagpa-consult siya sa medilink clinic and doctor, so doon siya nagpa-consulta sa accredited. Even the consultation of the doctor there is 500 and the plan that we have is the plan 500 which has 300 pesos consultation fee, wala nang babayaran si member. But if si member ay nagpa-check up sa non-accredited clinic and doctor at yung professional fee ng doctor doon is 500. So meaning, ang i-reimburse lang natin is 300 kasi yun lang yung kino-cover ng plan. Okay? Same idea with the treatment in clinic. Then diagnostics, x-rays, and laboratories, we have up to 6,000 in a year. For this particular example, nung nagpa-check up siya, na-requestan siya ng laboratories, nag-amount sa 3,000. So yung plan, kinover yung 3,000. Then ito na lang yung magiging remaining limit ng ating member. Depende dito sa naging example natin. Okay? And then, of course, we have the outpatient medicines for each plan option. Ayan yung mga limit niya per year. And then for the maternity benefit, we have this amount for the normal delivery, cesarean, and miscarriage. And then we have, of course, the annual physical exam and the dental benefit. Okay, so now we will be discussing the premium. Okay, so first let's discuss the premium for the principal or for the employees. So for example, we want to have this HealthLink Lite plan. So what is this HealthLink Lite? So it has the mandatory benefits only. So what are those? Those are the inpatient. So what are the inpatient? The room and board, the other hospital services, the surgical fee, the doctor's call, and of course, our group life insurance. So for the plan 500, it's 2,433 per person per year. If you wanted to get the higher plan, for example, plan 1,000, that's 4,187. And then, for example, we want this, standard HealthLink, the mandatory benefits plus the outpatient, and we want the plan 750. So this will be the premium per person per year. So that's how it works, okay? And for the dependent, these are the premium for the spouse or parent na dependent. And then ito naman yung premium natin for the children and siblings. Okay? As you can see here, no, walang benefit options na dental and annual physical exam and maternity para sa ating mga dependent. Also, we have this condition that the number of dependents enrolled must be at least 75% of the number of enrolled employees. Otherwise, an escalation factor will be applied on dependents premium. What does it mean? For example, if we are enrolling 10 employees, the 75% of that is 8. So that means 8 ang dapat ma-enroll na dependents. Otherwise, magkakaroon siya ng escalation factor na 35% on the dependents premium. Okay? So the hierarchy for our dependents is for married employees, legal spouse, and then dependent children, 15 days to 21. Single employee, parents, and then siblings. Single parent, dependent, and then parents. And we have maximum of 4 dependents per employee subject to hierarchy. These are the general exclusions. So you can just read it na lang po. So you would know what are the general exclusions. Choosing of plans, we can be level-based. So the higher the level, the higher the coverage, or you can have uniform plan to all the members. Member addition and deletion, you can add or delete member anytime during the policy year, and then the premium will be prorated. Upgrade and downgrade of plans, we don't permit in the middle of the policy year. For upgrade, you can send us an advice prior to the renewal, at least 60 days. Mode of payment, we have annual, semi-annual, and quarterly. And then we have these payment channels. Okay? So, HealthLink, your link to healthier and more productive employees. As we all know, no, where employees' health is a priority, productivity follows. Before I end this presentation, AIA Philippines and Medicard are now part of the AIA group of companies. So if you would like to know also the HMO product of Medicard, feel free to contact me.